1. Which of the following is the most important action for preventing the spread of infection in a hospital setting? Answer: hand hygiene. Explanation: hand hygiene is the most effective way to prevent the transmission of infectious agents, as it removes pathogens from hands before they come into contact with patients or surfaces. 2. What type of mask is required for healthcare workers caring for a patient with tuberculosis? Answer: N95 respirator. Explanation: an N95 respirator is necessary for airborne precautions, such as when caring for a patient with tuberculosis, as it filters out airborne particles. 3. What should a nurse do before applying sterile gloves to maintain a sterile environment? Answer: perform hand hygiene. Explanation: performing hand hygiene is essential to remove any potential contaminants before donning sterile gloves to maintain a sterile field. 4. When should a nurse wear gloves while caring for a patient? Answer: when handling bodily fluids or contaminated materials. Explanation: gloves should be worn when there is a risk of exposure to bodily fluids or contamination, which helps prevent the spread of infection. 5. What is the most important measure for preventing the spread of infection in patients with Clostridium difficile, C. diff? Answer: hand washing with soap and water. Explanation: alcohol-based hand sanitizers do not effectively kill C. diff spores, so hand washing with soap and water is the recommended method for infection control. 6. A nurse is preparing to clean a surface in a patient's room. Which of the following is the most important precaution to take? Answer: wear gloves. Explanation: wearing gloves prevents direct contact with potentially contaminated surfaces, thus reducing the risk of spreading infection. 7. A patient is placed in isolation precautions due to a suspected viral infection. Which personal protective equipment, PPE, should the nurse wear? Answer: mask and gloves. Explanation: for most viral infections, mask and gloves are required to prevent the spread of infectious particles through droplets or direct contact. 8. A nurse is assigned to care for a patient with a drug-resistant infection. What should be the nurse's priority action? Answer: follow contact precautions. Explanation: contact precautions help prevent the transmission of resistant organisms through direct or indirect contact with the patient or their environment. 9. Which of the following best describes the correct procedure for disposing of a needle after injection? Answer: place it in a puncture-resistant sharps container. Explanation: needles should always be disposed of in a puncture-resistant sharps container to prevent injury and infection. 10. What is the purpose of using a surgical mask during patient care? Answer: to prevent the transmission of respiratory droplets. Explanation: surgical masks help block respiratory droplets, reducing the risk of spreading infections through coughing, sneezing, or speaking. 11. What is the most effective method to prevent healthcare-associated infections, HAIs? Answer: proper hand hygiene. Explanation: regular and thorough hand washing or using hand sanitizer significantly reduces the transmission of pathogens and prevents the spread of infections in healthcare settings. 12. A nurse is caring for a patient with a draining wound. What type of precautions should the nurse use? Answer: contact precautions. Explanation: contact precautions are necessary to prevent the spread of microorganisms from the patient's wound to others through direct contact. 13. When should a nurse change gloves during patient care? Answer: after each patient contact or after handling contaminated materials. Explanation: gloves should be changed to prevent cross-contamination and protect both the nurse and patient from potential infection. 14. What type of precautions is required for a patient with measles? Answer: airborne precautions. Explanation: measles is transmitted via airborne particles, and airborne precautions, including the use of an N95 respirator, are necessary to prevent transmission. 15. A nurse is caring for a patient with a respiratory infection. Which PPE should be worn? Answer: surgical mask and gloves. Explanation: surgical masks prevent the spread of respiratory droplets, and gloves protect against contact with potentially contaminated surfaces or fluids. 16. What is the primary goal of infection control in healthcare settings? Answer: to prevent the spread of infectious diseases. Explanation: Infection control strategies aim to minimize the risk of healthcare-associated infections by reducing the transmission of infectious agents. 17. Which action is recommended to prevent the spread of infection when handling soiled linen? Answer. Place the linen in a laundry bag without shaking it. Explanation. Shaking soiled linen can release airborne pathogens. It should be placed in a sealed laundry bag to prevent contamination. 18. What should be done to prevent contamination when handling medication in a hospital? Answer. Follow proper hand hygiene before and after handling medications. Explanation. Hand hygiene helps prevent the spread of pathogens when handling medications, ensuring they are not contaminated before administration. 19. A nurse is cleaning a surface in the room of a patient with a multi-drug-resistant infection. Which disinfectant is most appropriate? Answer. An EPA-approved hospital-grade disinfectant. Explanation. EPA-approved disinfectants are effective against a broad range of pathogens, including multi-drug-resistant organisms. 20. What action should be taken if a healthcare worker accidentally pricks themselves with a contaminated needle? Answer. Wash the wound thoroughly with soap and water and report the incident. Explanation. Immediate cleaning of the wound with soap and water helps reduce the risk of infection, and the incident must be reported for further evaluation and management. 21. When should a nurse perform hand hygiene? Answer. Before and after patient contact, after handling contaminated materials, and before eating. Explanation. Hand hygiene is critical in preventing the spread of infections, and it should be performed at key times to maintain a clean environment. 22. What is the most important factor in preventing surgical site infections? Answer. Proper aseptic technique during the surgical procedure. Explanation. Using aseptic technique during surgery reduces the introduction of pathogens into the sterile field, preventing infections at the surgical site. 23. A nurse notices that a patient's wound dressing is wet and contains drainage. What should be done next? Answer. Change the wound dressing and wear gloves. Explanation. Changing the wound dressing ensures that the wound is properly managed and that the nurse is protected from potential contamination by wearing gloves. 24. What should a nurse do before entering the room of a patient on contact precautions? Answer. Don gloves and gown. Explanation. Contact precautions require the use of gloves and a gown to prevent contamination from direct or indirect contact with the patient or their environment. 25. Which of the following is a key component of infection prevention in neonatal intensive care units, NICU? Answer. Strict adherence to hand hygiene and sterile techniques. Explanation. Neonates have weaker immune systems, so strict hand hygiene and sterile techniques are crucial to prevent the spread of infections in the NICU. 26. How often should alcohol-based hand sanitizers be used in patient care? Answer. When soap and water are not available and hands are not visibly soiled. Explanation. Alcohol-based hand sanitizers are effective at reducing pathogen transmission but should not be used if hands are visibly dirty, where soap and water are more effective. 27. Which of the following is the primary mode of transmission for the flu virus? Answer. Droplet transmission. Explanation. The flu virus spreads through respiratory droplets when an infected person coughs or sneezes, making droplet precautions necessary. 28. What type of precaution should be used for a patient with an infection that is spread through airborne transmission? Answer. Airborne precautions. Explanation. Airborne precautions, including the use of an N95 respirator, are required to prevent the inhalation of small particles carrying pathogens. 29. How should a nurse handle a contaminated needle used for an injection? Answer. Place it in a puncture-resistant sharps container. Explanation. Used needles should never be recapped or discarded improperly. They must be disposed of in a puncture-resistant sharps container to prevent injury and infection. 30. A patient in the hospital has a multi-drug-resistant infection. What is the most important infection control strategy? Answer. Isolation and strict adherence to contact precautions. Explanation. Isolation prevents the spread of multi-drug-resistant infections, and contact precautions limit exposure to the patient's body fluids and environment. 31. A nurse observes a colleague not wearing gloves while handling soiled linen. What should the nurse do? Answer: remind the colleague to wear gloves for safety. Explanation: wearing gloves when handling soiled linen is critical to avoid direct contact with pathogens, which can lead to healthcare-associated infections. 32. Which personal protective equipment is required for caring for a patient with a cough and fever who is suspected of having COVID-19? Answer: surgical mask, gloves, and gown. Explanation: a surgical mask helps prevent the spread of respiratory droplets, and gloves and gowns protect against contact with infectious materials. 33. A nurse is caring for a patient who is under droplet precautions. Which of the following should be done before entering the room? Answer: wear a surgical mask. Explanation: droplet precautions require wearing a surgical mask to prevent the transmission of infectious droplets that can travel short distances through the air. 34. What is the most effective method for preventing the transmission of infectious diseases in a healthcare facility? Answer: implementing standard precautions. Explanation: standard precautions, including hand hygiene and proper use of PPE, reduce the spread of infections across all patient care settings. 35. What action should a nurse take if there is a spill of a body fluid in a patient's room? Answer: wear gloves and follow the facility's spill protocol for cleaning. Explanation: following proper protocols for cleaning spills helps contain the potential spread of pathogens while ensuring that the nurse is protected from exposure. 36. A nurse is preparing to give an injection to a patient. What should the nurse do first? Answer: perform hand hygiene. Explanation: performing hand hygiene before administering any medication is a fundamental step in preventing the spread of infection. 37. When should a healthcare worker change gloves during patient care? Answer: after touching potentially contaminated surfaces or after each patient interaction. Explanation: gloves should be changed regularly to avoid cross-contamination and to maintain patient safety during care. 38. What is the primary goal of contact precautions? Answer: to prevent the spread of infections that are transmitted by direct or indirect contact. Explanation: contact precautions help to limit the exposure to infectious agents by ensuring that protective measures, such as gloves and gowns, are worn when interacting with infected patients. 39. Which of the following is the most effective cleaning agent for surfaces contaminated with Clostridium difficile spores? Answer: a bleach-based disinfectant. Explanation: a bleach-based disinfectant is effective at killing C. difficile spores, which are resistant to many other cleaning agents. 40. A nurse is caring for a patient who has been diagnosed with a viral infection requiring isolation precautions. Which of the following should the nurse do first? Answer: don the appropriate PPE, including a mask. Explanation: donning the appropriate PPE, including a mask, helps to protect the nurse from exposure to viral particles and prevents the spread of infection to others. 41. A nurse is changing the dressing on a patient's surgical wound. What is the most important action to prevent infection? Answer: perform hand hygiene before and after changing the dressing. Explanation: hand hygiene before and after dressing changes is essential to prevent the introduction of pathogens into the surgical wound. 42. What type of precaution should be implemented for a patient with an antibiotic-resistant infection? Answer: contact precautions. Explanation: antibiotic-resistant infections can spread through direct or indirect contact, making contact precautions essential to reduce the risk of transmission. 43. A patient has a surgical wound with a large amount of drainage. What should the nurse do next? Answer: apply a sterile dressing. Explanation: a sterile dressing is necessary to protect the wound from contamination and to absorb excess drainage, reducing the risk of infection. 44. What is the most important infection control measure in preventing healthcare-associated urinary tract infections? Answer: proper catheter care. Explanation: proper catheter care, including hand hygiene and maintaining a closed system, is crucial in preventing urinary tract infections related to catheter use. 45. A nurse notices a colleague not following infection control procedures. What is the appropriate action? Answer: report the behavior to a supervisor. Explanation: Failure to follow infection control procedures compromises patient safety, and reporting the behavior ensures corrective actions are taken. 46. A patient is admitted with a known infection caused by a multi-drug-resistant organism. What type of isolation is most appropriate? Answer: contact isolation. Explanation: contact isolation is required for multi-drug-resistant organisms to prevent the transmission of resistant bacteria. 47. A nurse is caring for a patient with a compromised immune system. Which of the following infection control measures is most important? Answer: use strict aseptic technique. Explanation: aseptic technique minimizes the risk of introducing pathogens to patients with weakened immune systems, protecting them from potential infections. 48. What is the most appropriate way to clean a surface that has been contaminated with bodily fluids? Answer: use a hospital-grade disinfectant. Explanation: hospital-grade disinfectants are effective against a wide range of pathogens, including those that may be present in bodily fluids. 49. When should a nurse perform a surgical hand scrub? Answer: before performing a surgical procedure. Explanation: a surgical hand scrub is done to ensure that the hands are free of pathogens before performing any sterile procedure. 50. A nurse is caring for a patient on contact precautions. What PPE should the nurse wear when entering the room? Answer: gloves and gown. Explanation: contact precautions require the nurse to wear gloves and a gown to prevent contamination from the patient's body fluids or environment.